celebrating the baby boomer lifestyle. This is Boomer Life on CL650.
You know what's going to come up, this song. Sweet dreams are made of this. It happens every time when we talk about getting a good night's sleep. Joining us on our sleep expert here is Farouk Manji. Now, Farouk, we haven't forgotten about you. We will talk a little bit about, getting a good night's sleep from the side of being comfortable. Our special guest today is Dr. John Fleetham, who's the founder and co-director UBC Hospital Sleep Disorder Program, part of Vancouver General Hospital. Now, Dr. Fleetham, before the break, we're talking a lot about sleep apnea, but what can you do if you suspect somebody in your family? Often you said it's the spouse that's noticing that they're not breathing regularly through the night. So what are the steps to help get treatment?
Well, like everything, you start off by having a family physician. And if you look after your health, it's important to have a family physician. And then you go and tell them the symptoms. And sometimes it's just, you snore too much. And then there are simple things that can be done about that. Simple things are lose some weight, stop drinking alcohol in the evening, sleep on your side, different things like that. But if there are other parts of it, if there are what we call comorbid disease, if the patient has high blood pressure or heart disease or diabetes, if they have symptoms, if they if they're sleepy during the daytime, then it may be appropriate to refer them on in terms of additional testing. And that's really what a family physician is. They determine whether it's a simple issue or more complicated. So it always starts with the family physician. Then it's a matter of getting tested. The problem with sleep apnea is during the daytime, if you got it, you're totally normal. And so this only happens when you're asleep. And you need some form of sleep monitoring. One thing is to have a sleep study, and for that you come into a bed, conventionally in a hospital, and then you're wired for, you essentially have a polygraph recording to see whether you're asleep, whether you're breathing, whether you're not breathing. And so, that tends to be quite labor intensive. And for certain people, it's now possible to do portable monitoring, to take a portable monitor that will evaluate your sleep during the night. And so that's a decision which needs to be taken by the specialist in terms of what, how sick you are, what type of disease they think you might have and everything like that. But you need some form of a sleep study, either in a hospital bed or in your own bed.
Could you have a camera set up, recording and watching your sleeping, just to see and hear that you're not breathing? Could it be as simple as that?
It's interesting you say, and now, everybody has an iPhone and everything like that, and so there are all sorts of programs which are available. So what used to happen was everybody used to bring in tapes of their snoring, and I'd have to listen to those, and then they bring in videotapes, and now they come in with cell phones, and there are a variety of cell phone apps which you can get because they're sensitive to both noise and also body position that you can do. So, there are a variety of different clues which can be done. But if you're going to be diagnosed with a disease which you're going to have for the rest of your life and be treated for the rest of your life, it is important to make an accurate diagnosis. And so some of those things can be tricks, but it's important to make an accurate diagnosis.
So what's the difference between somebody that's just a good snorer and somebody who's got apnea? Where's the line there?
Well, there isn't a line. The line is it's a spectrum. So if you take 100 men, some won't snore. Most will snore a little bit. Some will be snoring every night. Some will snore and stop breathing. And then there are some people, which we used to call in medicine Pickwickian, who are in heart failure and everything like that. So it's a spectrum from nothing to really severe disease. And it's a matter of, and it's the same with high blood pressure. It's the same with diabetes in terms of, now we talk about pre-hypertension or pre-diabetes, and it's a spectrum, and individual patients can move back and forward on that spectrum. And so, but it's sleep apnea when you're stopping breathing and it's causing you to wake up during the night.
Okay, so what can you do for somebody that's being diagnosed with sleep apnea?
Well, as always, the lifestyle issues, and so lose weight. I mentioned it's much more. You don't have to be overweight to have sleep apnea, but it certainly helps. A lot of people like to drink alcohol in the evening. It unfortunately, it induces sleep, but then destroys your sleep and relaxes your muscles. So everybody tends to snore a little bit more after alcohol. If you can sleep on your side, that's a good thing to do. If your nose is plugged up and you're more prone to snore because of that, just treatment in terms of hay fever. Those are the lifestyle issues. But if it's more than a problem than that, it's important to have the correct diagnosis. So are you obstructive sleep apnea when you can't breathe, or is it central sleep apnea when you're forgetting to breathe? So you need to have sleep apnea is not all one thing.
So are you saying that there's a part of the brain that can actually stop you from sleeping?
Stop you from breathing.
Stop you from breathing?
Yes.
Really? Isn't that the core part of your brain, is to make sure all those vital functions are continuing on?
Yes, and so there's something called central sleep apnea, which used to be very uncommon. And it used to be uncommon because, people with brain injuries or anything like that. But now there is an epidemic of central sleep apnea, and it's related to this bigger thing that they're talking about in public health, and that's people taking opiates. So there's a big concern in the general population of drug addicts using opiates and stopping breathing during the night. But many patients are prescribed opiates for pain or to help them get over addictions. And we see people stopping breathing very frequently if they're on medications such as morphine.
That's interesting. Okay, so someone comes in, they're diagnosed with sleep apnea. What is the typical, other than lifestyle approach, that you can help them to get a good night's sleep?
With the treatment for obstructive, where they're snoring and stopping breathing, the classic treatment is CPAP. And what CPAP is it's a machine that blows air in through the nose. And essentially what it does is it inflates the back of the throat like you inflate the tube of a bicycle tire. And the reason it's so effective is it deals with the obstruction, which can be anywhere from the nose down to the larynx, to the vocal cords. And so it's effective in terms of that. CPAP was introduced 35 years ago. Patients, interestingly, they're very used to tablets and they're very used to surgery, but they're not used to having a contraption. And so, it's taken a long time for that to be accepted, but they now sell millions of these machines all year. They're manufactured by some of the major electrical manufacturers in the world. So Philips is a main manufacturer of CPAP. There are many different types of CPAP machines. They're getting smaller, they're getting quieter. Unlike any other treatment, they provide information. So if I am a doctor, and as a doctor, if I got a patient on CPAP, then I can go to my computer and I can look to see whether they're using the machine, and I can also see how effective it is. And so you can, unlike a tablet where you can't really tell whether a patient is using a tablet, with a machine you can see whether they're using it and how effective it is. So it takes some adjustment. Some people really take to it like a duck to water. Other people have to be convinced to use it, but it's a very effective treatment in the majority of patients.
Is it like many other medicines? Once you feel better, you think you don't need it anymore?
No, it's interesting. There's not much of a placebo with CPAP because you have to dress up and look like Darth Vader every night.
Mm-hmm.
But people use it not to please their doctors, but as soon as they stop using it, then their symptoms come back. And they're reminded of how badly they feel. So they will continue to use it because they feel better with it.
I'm guessing you feel better in night one using these machines.
Classically, yes. The story of how it was invented was there was a man and he was due to have a tracheostomy the next day. And then, one of my former colleagues tried this treatment. And the man woke up in the morning and said, I feel so great. I want that machine. I don't want a tracheostomy. And if you have sleep apnea, you have not dreamt for years. And there's something called REM rebound or dream rebounds. And suddenly people are overwhelmed almost by the amount of dreaming which they're doing because it's been sleep, wake, sleep, wake, sleep, wake for such a long period of time.
Wow, that's quite interesting. Is that part of the diagnosis as well? Do you have vivid dreams?
No. Well, it's part of the diagnosis. If you have sleep apnea, quite often you don't dream.
Yeah. Is that what you ask people?
As soon as you're, I saw someone yesterday actually said that. It's not a classic question we ask, but but it's not uncommon for people to be started on the treatment and then say, what was that? I haven't had a dream for. Sometimes they're scared by their dreams because they just haven't had one for a while.
That's fascinating. Well, I think it's we could go on forever talking about this, and I'm sure you get asked the same questions over and over. Is there anything we haven't touched on about people and their sleep, and other than the CPAP machine? Is there anything other than lifestyle?
There are other things. So this is sort of one of the things which pretty much developed in Vancouver. Because it's narrowing at the back of the throat, one of the approaches which was proposed some years ago was actually doing surgery to the jawbone and opening up the mouth that way. So we were proposing to do this close to 25 years ago, and then I have a joint appointment in dentistry, and so I was working with colleagues there, and they said, well, let's try an appliance in the mouth, which essentially moves the jaw forward. And so now this has become a major treatment in terms of both snoring and sleep apnea, is an appliance which you put in your mouth, and it's attached to your top teeth and bottom teeth and brings your jaw forward. And you see this advertised now on TV.
Yeah, that's the same
a variety of different. So oral appliances, and they should be done properly with an appropriately trained dentist, are another effective form in terms of treatment for this, and one which we use quite commonly.
That's good to know. That's not as invasive in your everyday life as, well, it might be, because that must take a while to get used to.
I mean, sometimes people like it better, but it's less effective, whereas they don't like the CPAP, but it's more effective. So there's a bit of a trade-off with both.
That's good. All right. Thank you very much for your time. That's Dr. John Fleetham. He is the founder and co-director of UBC Hospital Sleep Disorder Program, part of Vancouver General Hospital. Very informative. Learned so much today, and I'm sure our listeners have as well. Thank you very much for your time.
Thanks, Hank.
And we'll be back with more Boomer Life next on CL650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL650.